Well, by the end of 2021, Africa could receive 600 million doses of the COVID-19 vaccine through the World Health Organization's COVAX program. Plans are in the pipeline to vaccinate at least 20% of the African population. But according to the WHO, the buying frenzy by rich economies could limit access to the vaccine on the African continent and undermine efforts to contain the COVID-19 pandemic. Rose Wangoi has more.
The coronavirus has claimed the lives of about 82,000 people in Africa. According to the Africa Center for Disease Control and Prevention, the continent has recorded around 3.3 million COVID-19 cases. While these figures represent small fractions of the global totals, cases on the continent have increased by an average of 14% each week over the past month.
The first epidemic peak in July was surpassed in December, and cases are continuing to accelerate at a significantly faster pace. I think we have a combination of factors, possibly fatigue with the measures, and then, of course, the festive season with its travel and gatherings.
The WHO Africa Director says it's committed to vaccinate at least 20% of the African population by the end of 2021.
In Africa, COVAX is targeting phased delivery of 600 million doses by the end of 2021. This is based on 2 doses per person.
An initial 30 million doses are expected to start arriving in countries by March, with the aim of covering 3% of the general population.
These are intended to prioritize healthcare workers and other high priority groups, and then expanding to cover additional vulnerable groups.
According to the WHO Vaccine Introduction Readiness Assessment Tool, African nations are on average 42% ready for their mass vaccination campaigns, which is an improvement on the starting point of 33% 2 months ago. But there is still a long way to go to reach the desired benchmark of 80%. Experts are still trying to understand why Africa so far has not been affected to the same extent as other continents. Here in Kenya, the government has ordered 24 million doses of the COVID-19 vaccine developed by AstraZeneca, which are expected in the country in the second week of February. Rose Wangoi, NTV.